Assalamu alaikum, the clinical day. Your role is senior house officer in the medical clinic. Scenario, Mr. Joseph Allen, 25 years with complaint of palpitation. Sit with him, examine and address his all concerns. If you're ready, we can start after sharing the timer.
Okay.
Here you go.
Okay. Hello, Joseph. I'm Dr. Musa, doctor in the clinic today. Let me confirm you are Mr. Joseph, 25 years old.
Yeah. Joseph Allen.
Joseph. Okay.
Yeah, Allen. Yeah, call me my name full name.
How would you like to call you?
Joseph, yes.
Joseph. Okay, Joseph. Joseph, brought to my knowledge that you have racing heart. Could you tell me more about your condition, please?
Doctor, I don't know what's happening with me. I feel this feeling many times and it's bothering me.
I'm very sorry to hear about that, Joseph. Joseph, when it started exactly?
Started 2 months back, but it was less frequent. Nowadays, I feel it more frequent.
Okay, Joseph. Okay, wait, Dr. Basim, I will change the network because I think it is.
Okay, I will wait for you.
Yes, network is not good with me.
Okay.
Okay, Joseph, do you hear me now?
Yes, clear.
Okay, let's continue, Joseph. Joseph, it is worsening or improving since 2 months.
It's increasing, doctor. I told you it
Increasing.
was less frequent. Now it's more.
I'm very sorry to hear about that again, Joseph. Joseph, how many attacks did you have?
It was like once a week, but now being more frequent, maybe twice or thrice a week.
Okay. Any specific time, Joseph? At the morning more or at the night?
No, but most of the time while I'm awake.
Okay. Did it awake you from sleep?
No, doctor, I didn't feel that.
Okay. Did you notice that anything worsen this racing heart, like during eating or during exertion?
No, it's not related.
Okay. Did you notice that anything improve this racing heart?
No.
Okay. Okay, Joseph, it is like that or irregular? Can you tell?
No, it's like clock, doctor.
Cycle. Okay. Joseph, do you have any long-standing disease? Should be aware.
Like what, doctor?
What?
Like what?
Like any like increased blood pressure or increased blood sugar?
Yeah, doctor, you're right. I have diabetes type 1 and I am already on insulin.
Okay, for how long you have diabetes, Joseph?
Since I was child, doctor.
Okay, what medication you are on?
Insulin.
Insulin. You are compliant on insulin?
Yes.
Okay. Can you tell me how much you take insulin? What is the dose?
Yeah, the night dose almost 15, and pre-meal accordingly maybe like from 10 to 15 pre-meal.
Okay, Joseph, do you measure your blood sugar? Can you know the reading of the test?
Yeah, almost from 150 to 180.
Okay, what was the test of 3 months reading blood sugar?
It's 8.5.
8.5. Okay.
Yes.
Okay, Joseph, do you have any fever?
No.
Any lose weight?
In weight, yeah,
Yes.
I feel, doctor, I'm losing weight.
How much? And how much? How much kilo?
For the last 6 months, I think I lost around 3 kilograms.
3 kilograms. For how long? Sorry, Joseph?
6 months.
6 months. Okay.
Yeah.
What about your appetite, Joseph?
Mhm.
Is the same or
It's
lose your
good.
appetite?
No,
It's
no,
good.
no, it's good, doctor.
Okay. Joseph, you have any numbers on your body?
And no,
Okay. Joseph, do you have what about your do you have any bowel changes like loose motion
Yeah, doctor. I
or
notice also.
constipation?
No, it's not hard. It's loose, doctor.
It's loose. When it started?
The last month, doctor, I noticed my bowel habit being more frequent. I'm going to the
Oh,
bathroom more frequent.
okay, it is flushable, easy flushable, Joseph?
Yeah, yeah, yeah.
Easy flushable. Okay. Okay, did you notice that loose motion awake you from sleep?
It's not, doctor.
Okay. Okay. Um, um, okay, Joseph. Do you have any user preference, Joseph? Unusual cold intolerance or unusual cold intolerance?
Yeah, I don't like the hot, doctor. I prefer to be in a cold room. Always I put I on the
Okay.
fan and yeah.
Okay, Joseph. Do you have any shaking hand?
Yes, I feel my hand
Okay.
shaking.
Okay. Uh, Joseph, do you have any did you have any history of these spells?
Yes, doctor. I'm always feeling dizzy while standing from sitting.
Okay, sorry for that, Joseph. Okay, how many attacks you have these spells?
It happens almost whenever I'm standing from sitting. Yeah, so it's always, doctor, there.
Okay, Joseph. Okay.
I have to
Uh,
sit down for a while, then it goes.
okay. Any change in your skin, Joseph?
Yeah, doctor.
Um,
I noticed some dark areas in my under the arm and yeah,
or
and the
it
tummy.
is okay. It is flat. Flat. What is the color?
Yeah, it's dark.
Dark. Okay. It
Yeah,
is flat. It is flat, Joseph.
yeah, yeah, yeah.
Okay. Joseph, did you have any hair loss?
No,
Okay. Any joint pain, Joseph?
no,
Do you have any mouth sores?
no,
Any rash and stomach exposure on your face?
no,
Okay. Any rash on your body?
no.
Uh, okay, Joseph. Joseph, backing to your main
Yeah.
problem, what it is racing heart.
Mm-hmm.
Did you feel any chest pain?
Yes, doctor. When I feel this heart racing, I feel discomfort, chest discomfort.
Discomfort? Any shortness of breath?
Yeah, I feel it with this racing heart.
Okay. Any cough?
No, doctor.
Cough blood?
No,
Any phlegm?
no,
Okay. Do you notice that your leg is swelling, Joseph?
no,
Okay. Any nasal
no,
discharge or anything like that?
no.
Okay. Do you have any family history of any gland problem?
Yeah, my father was diabetic, and he was also diabetic since childhood.
Okay. What's your drug history, Joseph? Insulin only?
Insulin only. And for the
Oh,
headaches, sometimes I take paracetamol.
okay, Joseph. Do you have headache also?
Yes, I have headache.
Okay. Can you do, what is the site of this headache?
It's all over my head and dull aching one.
Okay. Sorry for that, Joseph. Can I? It is dull aching. Okay. Um, mm, okay. Any specific time of this headache?
No, no, no particular time.
Okay. No particular time. Okay. Joseph, do you follow up with your eye doctor? Any blurring vision?
No blaring vision.
No blurring vision or decreased visual your visual acuity?
No, doctor, I can see well.
Okay, very good. Okay. What about your water work, Joseph? Did you
It's
any change?
yes, it's more frequent.
More frequent? What about the amount?
Yeah, it's also increased amount.
Increase?
Yes.
Any flossy? Do you see any flossy urine?
Yeah, there is fourthness in there.
Okay.
Yes.
Okay. Um, Joseph, do you have any history of blood transfusion?
No.
Any sharing any delta 2?
No.
Do you have any servers that I know it's private question, but I asked always to all my patients. Do you have any history of casual unprotected relationship?
No.
Okay. Are you married, Joseph?
I have partner, girlfriend.
Okay. You are sexually active?
Yes, doctor.
Okay. Can I ask you if you have any problem in your intimate relationship?
No.
Okay. Okay. What's your job?
I'm a student.
Student, does this racing heart impact on your daily activity?
Yeah, doctor. When I feel this attacks, I'm feeling discomfort, doctor. I am worried about it.
Oh, I'm really sorry for this, Joseph, but I hope after this discussion we can help your
Okay, doctor.
condition. Do you smoke?
Yeah,
Okay. How many cigarettes and for how long?
around 10 cigarettes per day for the last 5 years.
I advise you also, Joseph, to stop smoking because you put yourself at a risk. So if you would like, I can refer you to smoking cessation clinic. He can help you about this
Mm-hmm.
issue. Okay, what
Okay.
about, do you drink alcohol, Joseph?
No.
Any history of travel, recent travel?
No.
Okay, sir. Okay, Joseph, can I examine you, please?
Yes,
Okay, the
please.
first I'll examine the hand for any clubbing, any thyroid acrobatry,
No.
any shaking of the hand, tremors.
Yeah. How you want to examine the tremors?
I want to examine put the patient hand in front of him and see if there
Okay.
is any shaking of the hand.
So you mean fine or flapping?
Yes, fine tremors.
Okay, there is fine tremors.
Okay, then I examine the pulse. I need to see the observation chart of the patient.
Yes,
Blood pressure
110, blood pressure
100,
150 over 100,
110
50 over 100.
over 100. Okay,
Yeah,
and the pulse,
the
the
what?
pulse,
Pulse 110,
pulse
110.
110. Okay, Dr. Bassem, blood pressure 150 over 100.
Yes.
Okay, and what about I want to standing position?
Postural hypotension, there is, yes, difference between sitting and standing.
Okay, then I'll examine for proximal myopathy, and also I need to see the
There
rash.
is positive.
Positive,
No
okay,
rash, it's the dark
can
pigmentation under the axilla.
okay,
Okay.
okay, and we'll examine the neck also for any GVP, and also if there is any eye problem like any exophthalmos or anything.
No exophthalmos. But what else you want to examine
The
quickly?
acuity and the field.
Okay,
The
acuity,
acuity,
okay. Field, it will take time. Okay, we skip.
yes.
What
Uh,
else specific?
uh, um, yes, but the movement,
Movement, okay, normal. No
normal.
ophthalmoplegia, no
Okay,
double vision.
I need
What
okay,
else?
I need the mouse for any pigmentation inside the mouse.
Okay, there is pigmentation.
Okay, and under is this pigmentation. Okay, then I will examine the lymph node, cervical
Okay.
and
No,
submandibular, and
no
also
lymphadenopathy. 2 minutes left.
okay, I will examine the thyroid for palpation only for the thyroid if there is uh, any swelling in the neck.
Yes, there is swelling. There is mass all over the neck. Diffuse.
Okay,
What you want?
okay,
How you want to examine?
okay. I will auscultate this mess, and also I need to do percussion on the sternum, and then I will examine the heart, apex and B2, and the base of the lung.
Okay,
Uh,
nothing there.
Nothing. Okay, very good. Okay, and then
1
um,
minute left.
okay, Joseph, do you have any concern?
Yeah, doctor. Is it something serious, doctor?
Joseph, after this examination and discussion, I appreciate your concern, but I think you have a disease of defense system. It is associated with your diabetes called autoimmune polyglandular syndrome. So what we are going to do, we will admit you in our hospital and do some investigation and maybe scans. Also, if our diagnosis is confirmed, you may need um, yes, you may need to wear a medical alert bracelet of having this disease. So we will have another meeting to discuss your problem. Is it okay with you?
Yeah, doctor, but you didn't answer my question, doctor. Is it
Yes,
serious?
yes, I think it is serious.
Okay. Okay, doctor.
Okay.
Still, it's already time is up.
Yes,
Okay.
time up. Yes.
Okay. Tell me what's your case?
Yes, today I examine Mr. Joseph, 25 years old, who is diabetic, type 1 diabetes. Mr. Joseph has palpitation, which is regular, has complaint of regular of palpitation. During examination and taking history, Joseph um, has uh, uh, unusual cold hot intolerance. Beside, he has regular tachycardia, and also he has dizzy spells standing from sitting position. I believe that Mr. Joseph has autoimmune polyglandular syndrome that consists of Addison and also diabetes and hyperthyroid.
Okay, what's your differential?
My differential diagnosis. Um, mm,
You have hypertension, palpitation.
yes, I should ask him hypertension if has
So what's your differential for palpitation with these symptoms?
palpitation maybe due to thyroid,
Okay.
hyperthyroid, or also pheochromocytoma.
Yes.
Uh,
Okay. What else?
um, um, uh, yes,
So
maybe
pheochromocytoma. What else? What types? What types? Okay. What types of hyperthyroidism you know?
hyperthyroidism.
Mm-hmm. You
Uh,
said this is hyperthyroidism, right?
yes,
So what type you know about hyperthyroidism?
hyperthyroidism, maybe autoimmune, and also maybe Graves,
Yes.
and autoimmune and Graves, and maybe thyroiditis,
Okay.
and also I don't know.
Drug induced.
Yes, drug induced.
Okay. How you investigate this patient?
First, I will admit Mr. Joseph.
You will admit
Uh,
him.
I will admit him. Yes, I
Okay.
will I will do to him apart from basic investigation, CBC and liver function test and kidney function test. CBC looking for hemoglobin and white blood cells if he has any infection. And also I will do for thyroid TSH, TSH, T3, T4, antithyroglobulin, and also will do him TSH receptor antibody and antithyroperoxidase. And also I will do ECG and echo for any complication. Also I will do short synectin test and short synectin test for Addison. And also I will do inflammatory markers and all electrolyte.
Okay.
And also
What specific
random
Mhm.
blood sugar specific for Graves.
for this condition?
Uh, um, autoimmune polyglandular,
Mm-hmm. Yes, you mentioned it.
autoimmune polyglandular gene.
Yes.
Mm.
What?
Autoimmune polyglandular antibody. What? I don't know.
No, no. Okay, what's the mode of inheritance of this disease?
Autosomal dominant.
So what you will do?
Yes, genetic test.
Okay. How you manage this patient?
Okay, I will admit this patient. I will give him hydrocortisone for Addison first, and then I will for cytotoxicosis I will give him carbimazole.
Okay, so you
And
start by
also,
pharmacological.
to be non-pharmacological patient education and counseling about the importance of be adherent and compliance to medication. We will advise him to wear a steroid bracelet to know other people to know about his condition, which is steroid. And also, first we will replace him with steroid and then carbimazole. And also meet a multidisciplinary team from gland doctor, occupational physiotherapy, and occupational therapy.
Okay,
Thank
fair
you.
enough. Fair enough. Okay, well done, Dr. Mahmoud.
Thank you.
What do you think? Did you miss a lot of
Uh,
things, or
I
you? Yeah.
yes, I think I missed an examination, thyroid examination.
Yes. That's why I'm trying to give you the cases which is common in the exam, and
Yes.
it's complicated. This is the case in exam. They should bring, or they are bringing nowadays, cases with findings, a lot of findings. So in this patient has three association, which are thyroid and diabetes and Addison.
And that is
Yeah, and the case is autoimmune polyglandular. Yes, it is. But how to examine the things related to the case? What is the case here about?
palpitation,
And the most common cause is
cytotoxicosis.
yeah,
Mm.
thyroid means you have
Thyroid.
to examine thyroid from A to Z, right? Did you
Yes.
examine it well? Do you think you
No,
can?
the eye. I think the eye. There is a problem in the eye examination.
What you miss in the eye also? You examine the eye exophthalmos and visual
Exophthalmos,
acuity.
yes, I need
Huh?
also accommodation. The accommodation,
No, it's not affected.
the eye, uh, light reflex or no?
No.
Okay, in the
What
eye,
could be
and
affected in Graves as eye examination? You mentioned exophthalmos
yes, exophthalmos,
and
lid retraction
yes, lid detection and lid lag. Yes.
and red lag. Yes, I will
Yeah.
put my
Yes.
finger, yes, opposite to the eye, and then
Mhm.
do a circle. Yes,
Yes, exactly. So this instead of acuity and field here, suppose not affected, right?
yes.
If you can do, if you want to do, you will do this lid lag and You already examined the exophthalmos. How you examine the exophthalmos?
Exophthalmos, I will put my finger opposite to his eye and see if there is any whitening of the eye.
How?
Up,
Where you stand to examine it?
ah, yes, yes. Exophthalmos, I will stand behind the patient and
Okay.
let him
Yeah.
extend something,
Yeah. He will
and
look up.
then
Yeah.
I will see
He
the tip.
extend the neck. Yes.
Yes, the cornea in front of his. Uh,
Yes. Below
uh,
the upper eyelid. What about
yes.
proptosis?
Uh,
How you
or
examine it?
Yasim Dr. Bassem, I think.
No,
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 from the
and from
side.
the side. Yes, from the
Yeah.
side.
So beside the patient, and you will look to the
Mm,
same whitish area behind, below, above the lower lid eyelid. Okay.
yes.
Okay. So this is for the lid retraction, and yeah, if you want ophthalmoplegia, its shape, it makes sense to examine it because it's sometimes
Mm,
associated with ophthalmoplegia. Okay, any
yes.
double or any pain. This is for the eye. For the thyroid itself, you miss
The
all
side first,
items. Yeah.
yes, inspection, palpation from behind, and then percussion, the thymus,
What the most important step in instruction?
inspection, palpation, percussion, auscultation.
How to do an inspection?
Inspection for extension of his neck. I will tell him extend your neck.
Okay, before palpation, the inspection, you want to ask him, and you want to know, is it related to something? What is it?
Yes, if there is any compression, any dysphagia
No.
shortness
By
of breath.
inspection, you want to know this is a
Yes,
thyroid.
yes, drink some water. Yes, it is the
Yes.
most
See
important.
this small steps.
Yes, I know.
Yeah, it might fail you if you didn't do so. Take this sip, please. Sip of water. Drink it. He will swallow. It will move with swallowing, right?
Yes, Dr. Bas.
Again, when you stand behind the patient for palpation, you will ask him what?
Extend his neck.
Yeah, from side to side, and you put the hand in the side
Yes,
and press.
the thyroid.
And what you will ask him to do again?
Uh,
Just to drink a sip, right, of water.
yes,
Okay. These things very important, and the
yes.
consistency, the
Smooth
the
or nodular.
yes, a bit diffuse or okay. Lymph node you mentioned, which is good. Any examination, remember the lymph node. Even it's not necessary
Yes,
some condition, but do it or offer it. Most of the case you have to do it. Like in this patient, you might do it, okay, or you have to do. Sorry, it's not. You have to do it, or you offer it if you don't have time. Then I should start from the hand, of course, but you did the hand well. You ask for the creases. You have to see the creases for Addison, right?
yes.
You didn't see the creases.
Yes,
I
no,
mean the
no, don't
palm.
see. Don't see. Yes.
Yes, you have to see the creases and the pulse, of course, the volume, and the tremors. You did all this and acrobacy for thyroid acrobacy. Okay. The proximity, you did it. The prox always remember the vitals, and whenever you offer the blood pressure, offer sitting standing. Okay.
Okay, doc.
So you cover the hand, the eye, the thyroid. It's more than enough in this patient. You have to examine those things. By the way, finger break mark also for blood sugar.
For diabetes. Yes.
Yeah, and sometimes type 1 diabetes, they might have CGM, continuous glucose monitoring. So you have to examine at the arm side.
Mm.
Okay, it's a available device. It can be connected to the arm. Okay,
Okay, doctor.
offer it, or you can expose the arm or whatever you want to do. Just offer it, or you can do it. The thyroid, we finished the eye and the thyroid. You did the auscultation, the percussion for retroexternal extension, and the Berui, of course, as you did. The heart, yes, the heartbeat, and murmur, but it will be quick examination. Heart failure, yes, you can do offer the fine basal crackle by basal crackle, but it will be the last thing to do. If you did the thing I mentioned to you well, the hand, the eye, the thyroid, and this is fair enough. But if you have time, you can do the heart failure signs as you did, and for leg edema.
Peritoneal myxedema. Peritoneal myxedema.
Oh yes, any peripheral myxedema or even edema for heart failure signs as a failure. I mean, I think this is the case. Let's start the
Yes, and
skill.
also the reflex, the knee reflex.
Yeah,
I
it will be
forget.
exaggerated. Yes, tendon. Yes, ankle or knee. One of them is enough. Exaggerated tendon reflex. Okay. Let's start the. Okay, physical examination. What do you think? Did you examine all?
No, I think borderline.
Yes, so it's borderline. Identifying the finding.
Uh, I think satisfactory, Dr. Basil.
Okay, the thyroid.
The
Do you know?
thyroid,
Yes, what the thyroid state? Did
yes,
you
it is,
auscultate and you auscultate and you did percussion, right?
yes,
But you didn't examine for the palpation, right? You didn't give water.
yes, yes. Answer this, huh?
What I am doing,
No,
yeah, what I am doing now, just
unsatisfactory, really.
no, at least borderline because you examined the eye, but also you didn't do the pathological test in the eye. I mean,
Mhm.
the lid retraction and lid lag. which is also pathognomonic in this patient, right?
Yes, doctor.
Okay, let's say borderline, and it will be only motivation. Okay, it's just for the motivation, not for.
Yes. Next time I will not forget.
Yes,
Really.
of course, and you might have the case in the exam.
Sure. Yes.
Yeah, it's common case. Thyroid, one of the important steps and one of the important case, and the examination steps examination is very important. This is one of the most common miscellaneous topic in the long clinical consultation. You will not face it in the short, so you might face it one of the long clinical case. Okay, the clinical communication, the driving, but you ask about the vision
Yes,
anyway.
yes. Yes, no
You ask
vision.
about the vision. Yeah, it wasn't there anyway. If the patient vision was affected, you have to ask for driving. Okay,
Yes.
recreational drugs here is very important because it might be the reason of palpitation. You didn't ask about recreational drugs.
You know,
For
Dr.
the
Basim,
diabetes,
I will take
huh,
photo of paper now. I write driving and the illicit drugs, really, and the coffee and the tea, really. I write all these things.
yes, I
Mm.
know, but the examiner will not respect your paper at all.
Yes, sure.
Really, they don't care about what you wrote, what you said, what you thought, what you put in your mind. They think or they care about what you said and what you did.
Hmm.
Okay, clinical
Yes.
communication. So still the diabetes control. You didn't ask about hypoglycemic attacks. Hypoglycemic attacks. This patient type 1, he might have hypoglycemic attack. It's common
Yes.
you have to ask even once. Do you have any? How is your blood sugar control? Do you have any hypoglycemic attack? So you can
Hmm.
ask about retinopathy, nephropathy, neuropathy, and the hypoglycemic attack. For the neuropathy, you didn't ask for any
Renal
stress
disease.
and weakness.
Yes.
Yeah. So again, it's borderline.
Yes.
I think you cover the palpitation as a complaint well. Ask about the timing, the exaggerating factor, the factor improve it, the regularity, and the relevant system, which is the heart. You ask about chest pain and discomfort, short of breath. I think you cover all the question for the thyroid itself, any intolerance to the weather, the intimacy also you remember it, which is good. I think, yeah, it's borderline again. Clinical judgment, I think it's satisfactory. You didn't give me wrong information. Differential diagnosis, yes, you did it well. Started by the case, which is autoimmune polyglandular syndrome. And you can say Graves' disease or autoimmune as association. It might be association only without autoimmune polyglandular. However, you have Addison here, but you can say it's autoimmune, right?
Yes.
And pheochromocytoma. Okay, he might ask you what the possible cause of hyperthyroidism, as I ask you. So, as you said, you can say Graves in the top as a commonest, and the second, uh, as you said, it might be thyroiditis, whatever the cause of thyroiditis, because thyroiditis, any patient with thyroiditis might be either euthymic or euthyroid or hyperthyroid or hypothyroid. He might be in the state of hyperthyroid. Okay, so thyroiditis might be the case or the differential. The last thing is drug induce. Okay,
Doctor.
so the differential, I think yes, it was satisfactory. The concern I ask you, I will minus you in the concern. Why? Because you didn't have good time for the concern, and you explain a lot about the disease. And my question was, is it serious, doctor? Please focus on the concern, what he's
Mm.
asking you. Don't give me information I didn't ask you about. I didn't tell you what I have. I just asked you, is it serious, doctor? So yes, either yes or no, whatever the answer. And give me chance to ask you another concern. It was 1 minute and you explain a concern which I didn't ask about, and you didn't give me chance for another concern. For this case, I will ask you about the kids. Any possibility for my kids to have this condition? Okay.
Yes.
So this is for the concern. The admission here, I don't know. You said you will admit the patient. Do you think this patient need admission? And what?
I
Why?
think I
For
think
what?
yeah.
Okay, for what? What
Mhm.
is the emergency indication of admission in hyperthyroid?
Yes, not in crisis of Addison, not crisis thyroid.
Yes,
So
no question. Exactly. Yes.
if he has fever or anything or vomiting, so I will admit. Yes,
Mhm.
yes, Dr. Bas.
So yes, he can be referred to a clinic and or outpatient clinic for referral, but it's not urgent emergency admission. Okay.
Yes,
Uh,
doctor.
yeah, this is the case. So I didn't mark for the welfare. Yeah, welfare will be satisfactory. Okay, this is your case. Any question, Dr. Mahmoud?
Uh, no, Dr. Bas, thank you.
Okay, focus on these things, especially the examination. And when you call the patient name from first time, call his name, his full name. If, for example, three names, call them. Then how can I call you, or you can call him by his first name?
Mhm.
Okay, it's Joseph
Oh,
Alan. So are you with Joseph Alan? Yes, I am. Two identifier, which is the age and the patient name, not only one name. Then you can call him as you said in the scenario, Joseph, all the scenario. Okay, any other question from you, Dr. Mahmoud?
thank you, Dr. Bas. Thank you.
Yeah, I'm trying to give you common
Yes, it
cases.
is a good case. Yes, Dr. Bas,
Yeah,
sure.
I know it's a known case, but how
Yes.
to do the steps of examination, how to manage the time, it's difficult. And once it's in the exam, it will be also good, and you remember all these things. Give me the case. Yes, Mr. Sami again has back pain, 48 years, not responding to any analgesic. Investigation increased alkaline
Alkaline phosphatase,
phosphatase,
normal corrected calcium.
non-corrected calcium. Okay.
It's a rare case.
Yeah.
Really.
Okay.
In exam.
Anyone? Yes. Okay. I will start after 2 minutes. If anyone has comment or question or judgment, you
Yes,
want to
Dr.
minus
Best.
Dr. Mahmoud. Yes, Dr. Muhanna, go ahead.
So just in Addison, what is why we are examining creases of the hand?
It will be darkened
Darkening,
as
for
yeah,
darkening.
yeah.
Okay. Always confusing because it's not common practice to do. Lid lag and lid retraction, exophthalmos. Again, steps how to examine lid lag and lid retraction.
Okay,
Is it-
the lid retraction,
Mm.
you will stand behind the patient.
Okay.
So you can you stand behind the patient for three examinations: the thyroid and the exophthalmos and
Mm.
the lymph node.
Okay.
Okay, lid lid lag, you will stand in front of the patient. We finished the lid retraction, which is exophthalmos. Okay, lid retraction. It will be showing a rim of white area below the upper eyelid.
يعني فوق يعني.
Yes, yes. And this is for first thing, the lid retraction. The second thing is lid lag. You will stand in front of patient and tell him walk to my finger in front of him at the same level of his eyes and move your hand quickly up in a circular manner and go
Okay.
down again. You will notice the eyelid late in the response to go down back. Okay, it's called lid lag. I mean there is delayed movement and the upper eyelid. And the
So
third,
lid
what
lag
was?
and the lid
You asked.
retraction, upper eyelid, both of them.
Yes.
For
Yeah,
upper eyelid.
boroptosis, the down, yeah, the lower lid for boroptosis, and you can notice it from the side. Beside the patient, you will stand and you will notice also whitish area below, above the lower lid. This is the difference between proptosis and exophthalmos. What the third? What was the third?
Proptosis. I think proptosis
Yeah.
is behind the patient.
Behind the patient. Yes.
Proptosis beside the patient.
Besides the patient.
So what
Yes,
behind the
beside.
patient?
Thyroid,
Exophthalmos.
exophthalmos, lymph node. Thyroid, exophthalmos, lymph node.
And also, Dr. Bassem, there is important information that if the patient is hyperthyroidism, even eye affected or not affected, we will examine the eye.
Yes, of course.
This
What do
is
you think?
most
It's
important.
a must.
Yes.
It's a must. Yes.
If the
To get the
patient
mark.
has normal eye, examine the eye examination
Yes.
also.
To get the mark.
Yes.
Okay. And if any affection to the eye, Dr. Mahmoud, you will admit the patient, especially the exophthalmos or proptosis, because the exposure keratitis, one of the complications, and it's very dangerous. You can you have to refer the patient to ophthalmologist immediately. Okay.
Yes. Even
What
the
if the
patient
patient has what if he has exophthalmos? How you manage it?
external eye protection.
I mean,
First eye protection
okay.
by wearing glasses or eye drops, and then
Okay.
steroid. We give him steroid,
Yes, perfect.
and also orbital defenestration surgery. I think there is surgery
And what's the important here? The
to
responsibility of surgery if
protect
the
the
most
cornea.
important advice. The most important advice in this patient, he was
Yes, during
yes, exactly.
during sleep, cover the
No. Stop smoking.
yes,
Stop
stop
smoking.
smoking. Yes.
Yes. Always think, Dr. Mahmoud, to start by the non-pharmacological. It's very important. You can get mark for these things. Counseling, education, complication, and complication disease manifestation. These things will give you mark without harm, and it will waste time before going to the pharmacological.
For thyroid eye
Okay.
disease, eye protection,
Yes.
steroids, stop smoking, orbital decompression. Is it right?
Yeah. And surgical option.
Yeah, orbital decompression. Driving.
Yeah, orbital decompression. Yes.
Yes, Dr. Ahmed, it is the best interest of this patient.
And what contraindicated in the Graves' eye disease?
Iodine.
Radiation. Yes.
Yeah, iodine.
Radioactive
Yes.
Radioiodine.
Yes, iodine.
Why admission for thyroid eye disease?
One of the indication is eye disease. Yes, because the eye manifestation and the complication is very dangerous. I mean, the keratitis, exposure keratitis, one of the complication and difficult to treat it. It might reach to a corneal transplant. So why you will wait for it? You have to admit the patient immediately to refer him to the ophthalmologist and to cover it and to give the natural tears and consider steroids.
Need admission or just instruction and urgent referral to ophthalmology?
In this condition,
Thyroid eye disease.
yes, need admission. Not only referral, admission with referral.
So what the admission will do? Because there is no not offering any kind of treatment. Just it is warning.
Steroids.
That's enough.
You mentioned the steroid, one of the management, right? And by the way, it's IV steroid.
IV.
Yeah.
Systemic steroid.
Dexamethasone. I think it's dexamethasone. Okay, clear, Dr. Ahmed? Yes, Dr. Azhar.
For the eye disease, we can give corticosteroid radiotherapy and then orbital decompression. That's why we will admit the patient. We will do the stepwise approach. The patient is not responding to corticosteroid, then we may consider for radiotherapy. If still not, then we can go for the orbital decompression surgery. That's why we are admitting.
Thank you, Dr. Azhar. Yes, you're right. Plus, the most important advice is stop smoking.
Yeah.
Okay.
and no radio ID.
Yeah, no radio ID is contained case. Any comment, Dr. Azhar, for the previous case?
No, mashallah. You explain each and everything very well.
Okay, any comment on the judgment, the performance, Dr. Mahmoud? You want to advise him?
Mashallah. He did very well in this case. He did very well. But only the time management was a problem and the examination was a problem.
Yes.
Yes. Thank you, Dr. Azhar. Thank you very much.
Hopefully, Dr. Mahmoud, face-to-face examination and taking history much shorter in time.
Yes,
So
8 minutes.
it will help you. I mean, no, it's in the internet or online practice, the time always being longer. But in the practice, I mean the exam or even you practice with any colleague face to face, it will be good timing. So don't worry about it. But don't take also long time in the history. The unnecessary question, you can skip it.
Okay, Dr. Bassem.
Dr. Bassem, before moving to the next station,
Yes, go ahead.
palpitation. So palpitation could be thyroid, anemia, heart, so like QT, hokum, or just caffeine, tea, recreational drugs.
Exactly.
What of chromocytoma? Just to ask targeted question for those. Is there anything else can cause palpitation?
Recreational drugs, you mentioned?
Yeah, recreational drugs, anemia, thyroid,
Thyroid, heart disease.
chromocytoma, heart disease, which is long QT syndrome or HOCM, which is very common.
Yes, come before Ahmed patient pregnancy.
Pregnancy. So
Yes,
pregnancy can cause.
pregnancy. Yes, come before. Yes,
Yeah.
patient was pregnant.
So add on pregnancy.
Yes, palpitation and vomiting. Patient was presented with palpitation and vomiting. So it is hyperemesis gravidum plus pregnancy plus thyroid.
Okay. If the patient came with palpitation here, should I examine the heart first?
Sure.
Then move to thyroid. So
it's no. The thyroid. I think
it's more important thyroid, but
yes.
But the
because
patient
this is the underlying cause. Okay, you examine the pulse peripherally.
Like bleeding, just rectal bleeding. So digital rectal examination and the stool sample offer colonoscopy. Then this is I mean examination wise should start with the complaint, then positive signs. So if came with chest pain, examines heart, then move on. Palpitation, examines heart, move on thyroid.
Don't forget we examined already the pulse. It's also palpitation related. Pulse and pulse volume. The regularity and irregularity. It's also complaint.
But the pulse in pulse and basis is general examination. It's not heart examination.
But I don't think you have to examine the heart before
No,
thyroid. Because
I mean
thyroid will take time.
just apical pulsation, base of the lung, basal crackles, lower limb, just breathe. Yeah, but if the patient came with cardiac symptoms, start with the
okay,
heart.
this is different. If the complaint was heart, yes, of course you will start by you will skip the thyroid. You will do one test for the thyroid if you suspect the thyroid. Just palpate for any mass, because palpitation might be as cardiac, but you want to rule out thyroid. You can do it once. I mean, quick exam for the thyroid to rule out thyroid, but you can also rule it out by the history. If he asks you, did you examine thyroid? No history of thyroid disease or no complaint of intolerance to weather, I mean. But at least offer it. You can check by hand quickly any thyroid swelling. That's it.
Okay.
I mean, the complaint was palpitation. Okay. Regardless to this case, you got it. And the heart examination will be all steps: inspection, palpation, and auscultation, plus ausculting the back. Clear?
So if patient came with the heart failure, I should examine everything in the heart, inspection, palpation, auscultation.
Yes, heart failure. Yes, you have to detect the apex beat. This is by palpation. Inspection for any scar. Maybe he is post PCI or post cabbage. Heart failure might be related to the heart itself. So you can examine for pacemaker. Might be he has pacemaker. I'm talking in general, not a particular condition. So pacemaker by inspection, any scar in the chest for mid-sternotomy scar, any other scar in the other areas, any catheter scar. This is by inspection. For palpation, you palpate the apex beat, and you will palpate if he has, for example, pacemaker, you will palpate over it. If he has catheter, you have to examine the catheter. Then palpate for parasternal heave and loud P2 for pulmonary hypertension. This is for palpation. The auscultation, as you know, from the apex, every valve, apex, mitral, and tricuspid, aortic, and pulmonary, and go to the back, examine for fine crackles for heart failure. And don't miss the raise GVP by pressing the abdomen. Okay, clear?
Okay. Okay.
Yes, thank you. And Dr. Well, a lot of comment. I didn't see these comments. Okay, I will read it before I start, Dr. Mahmoud. Eye symptom need admission? Yes. For pulse thyroid, yes. Topiramab, a new drug for Graves' ophthalmopathy. Examiner, oh my God, question by exam nowadays. They reach to this monoclonal teprotumumab. Teprotumumab. I never memorized the name of monoclonal, apart from infliximab and those medication, adalimumab and etanercept. Teprotumumab. Okay, please, you can share it to the group also. In refractory ophthalmopathy, rituximab is used. Okay, great. Pulse steroid, methylprednisolone, not bexa. Okay, admission with urgent ophthalmology of consultation. Steroid radiotherapy, stop smoking. Yes, Dr. Jojo. Thank you, doctor. Okay. Any comment apart from this? We can move to the next scenario. Back pain. Okay. For Mr. Sami, he's 48 years, has back pain, not responding to any analgesic, investigate increase alkaline phosphatase, normal corrected calcium. Okay, let's start, Mahmoud.
As Dr. Bassem, as an exam, I will tell you everything as an
Yes,
exam,
yes, yes,
even
yes.
the question of examiner. Okay?
Okay, just remind me when 2 minutes left.
Okay, doc.
Let's start. Hello, Mr. Sami.
Yes, doctor?
You are 48 years.
Yes, doctor.
I'm Dr. Mukhtar, the doctor in the clinic today. I will examine you today and take history.
Thank you, doctor.
Can you tell me more about your complaint?
Yes, doctor, I have been complaining from back pain. It started since, I think, 1 month or 3 weeks. 3 weeks. And since it started, can improved with painkiller. Now, doctor, the pain not improved with any painkiller.
Okay, I'm so sorry to hear about that, Mr. Sami.
Thank you.
Be sure
Thank
that we are here to help you and support you.
Thank you, doctor.
The nature of this pain, is it dull aching or stabbing?
I think, doctor, it is dull aching. Yes, dull aching.
And was it there before, or this is first time ever?
No, doctor, this is the first time.
First time. And
Yes.
is it improving or worsening with movement, do you think?
Worsen with movement, doctor.
Worsening with movement. Okay.
With movement, yes.
Yeah. Does it go anywhere?
No, doctor, I don't think so.
And where exactly this pain? Is it in the upper part or middle or the lower?
No, down, the lower, doctor, in the lower back.
Lower. Okay.
Yes, doctor.
And you told me it's not going anywhere.
No, doctor, no.
If I give you scale from 0, no pain, and 10 is the maximum, how can you scale this pain?
I think, doctor, now is 7 or 8.
Okay. Do you need some painkiller right now?
No, doctor, thank you very much. I take painkiller.
Okay. You have any pain else in any area else?
No, doctor, I don't think so.
Okay. Uh, you have any weakness in your legs?
No, doctor.
Any change of sensation in your legs?
No, I don't notice that.
Sorry for this question. Did you lose the control over your bowel or your water work?
No, doctor, no.
You have any joint pain?
No.
Any muscle pain?
Muscle pain, no.
Any skin rash?
No.
Any stiffness in your joint?
No, doctor.
Okay. Any neck pain?
No.
Okay. Did you notice any change of your hat size or your head size?
No, doctor.
Okay. You have any history of fracture?
No, doctor, never.
Any admission before to the hospital?
Admission, no, doctor.
Any surgery before?
No.
And you have allergy to any medication?
No, doctor.
You have any long-standing disease I should be aware of?
No, doctor. No.
Okay. You are taking any medication? Can you show me your medication list?
I didn't take any medication, doctor. Just a painkiller mm, for my back pain. Yes.
Any over-counter medication?
No, doctor.
Can I know the name of this painkiller?
Paracetamol.
Paracetamol. Okay. You have any family history of same condition?
No, doctor.
Any family history of cancer?
No.
Okay. And any travel recently?
Travel, no.
Okay. I will ask you questions. Maybe sound not related, but it might help us. Okay.
Okay, doctor.
Do you have any headache?
Headache, no.
Any blurring of vision?
No.
Any hearing problem?
No.
Okay. Any balance or unsteadiness?
No.
You told me no pins and needles in your legs. Any pins and needles or in your hand or weakness?
No, doctor. No.
Any lumps in front of your neck?
No.
Okay. Any weather intolerance?
No, doctor. No.
Any difficult swallowing?
No.
Any skin tightness?
No.
And any chest pain?
No, doctor. Never.
Any awareness of your heartbeat?
Awareness of heartbeat, no.
Any short of breath?
No.
Any tummy pain?
No. No, doctor.
You have previous tummy pain?
Previous I had inflammatory bowel syndrome. Irritable bowel syndrome.
Irritable bowel syndrome. And
Yes.
when it was diagnosed with you?
I think, doctor, since 20 years.
Is it controlled?
Just a bit, doctor. It's controlled. Yes.
Okay. And you take any medication for it?
No, doctor. I adopted the lifestyle and regime diet, and everything is good.
Okay, good to know.
Alhamdulillah.
Any bowel habit change?
No, doctor. Just I have some loose motion, but once I adopted the lifestyle and the diet regime, it is improved.
And when was the last loose motion?
I think, doctor, since 1 month. 1 month. Yes.
And is it controlled now?
Yes, doctor.
Did you take antibiotics for it?
No.
Okay. You have any change of your bowel habit? Sorry, if your water work?
No, doctor.
Any increase of frequency? Any blood coming with the water work?
No.
Any stone?
Still no, doctor.
Nothing. And any infection before in your, sorry for this question, in your private area?
No.
Okay. You have any high body temperature?
No.
Any night sweat?
No.
Okay. You have any change of your weight?
No.
Appetite?
No. I
Any-
have gym diet. Yes. Everything is good.
Okay. Are you using a strict diet?
Yes, doctor.
What type of diet you are taking?
Yes, it is a regime by my dietitian, but everything is good. Yes.
So is it restricted to a certain type of food?
No, doctor. It is balanced.
Balanced. Okay,
Yes.
good. Okay. Any lumps or bumps in your body?
No, doctor.
Do you smoke?
Never, doctor.
Never. Okay. And do you drink alcohol?
No, never.
Okay. This back pain is affected your driving if you are driving?
No, doctor. No.
It's good. Okay.
Yes,
What's your job?
I am a teacher.
And what's the impact of this complaint over your job?
Just a bit, doctor. I take painkiller and I can stand, no problem. But since I think 3 days, I can't tolerate, doctor.
3 days. You said 3 weeks started, but
3 weeks started, now not improved.
not improved since 3 days.
Yes,
Okay. Can I examine you now?
sure, doctor.
Okay. It's starting from the weight. Is he overweight?
No,
Normal
yes,
average?
normal average, yes.
Okay. And the vital chart? How the blood pressure?
Normal,
Normal
pulse,
blood
blood
pressure.
pressure is normal.
Okay. Temperature?
Can't what, doctor? Temperature
Temperature.
normal.
Okay. Any characteristic finding in the hand?
No,
Any stiffness in the hand?
no,
Any skin tightness?
no.
In the pulse? How the pulse? The volume
Regular,
and character?
regular, normal, no change. No
Okay.
specific
I will
character.
look. Okay. I will look at his head or skull. Is it okay, or any change of the size of the head?
Normal,
Nothing.
normal, yes.
I will do hearing examination. I will
Normal,
offer it. Normal.
yes.
Any vision affection? I will open. I will ask him to show me his eyes. Any pallor or jaundice?
Normal,
Nothing.
yes.
Can you open your mouth, please, for me?
Okay,
Any
that's my
sores?
mouse. No,
Nothing there.
nothing, doctor.
Okay. Now I'll examine for the. I will ask him to expose his back, all his back.
Yes, now
Any
exposed his back.
any kyphosis, scoliosis,
No,
deformity?
no, doctor.
Nothing.
It is normal.
Can you point to me the site of the back pain?
Yes, it is the back, doctor. Yes, in the
Down.
down the
Lumbar?
spinal cord. Yes, lumbar. Yes,
Okay. I will check for any deformity there, any swelling,
no deformity, doctor, but it is severe pain.
severe pain.
Yes, doctor.
Okay. Any redness?
Any illness? No.
And when I ask him if the pain move anywhere, he can show me any area of radiation, right
No,
or
doctor.
left?
I can't notice. No.
Nothing. And it's
Yes,
localized to the lumbar vertebrae.
yes, doctor.
Okay. Now I will examine the. I will offer for the tone of anal tone. I mean, digital rectal examination of anal tone. I
Yes,
will offer
normal.
normal.
Yes.
Any? Do you feel different sensation while after your bathroom when you're peeling this area or rubbing this area? Sorry.
Sorry, passing
Saddle,
bathroom?
saddle. Yeah. Any anesthesia or saddle area?
No, doctor, I didn't notice. No,
Nothing. Okay.
nothing, doctor.
You have partner?
Yes, doctor. My wife.
Uh, any casual relationships?
No, doctor, never.
Okay. You have kids?
Yes, doctor.
And you have any, sorry for this question, are you using any recreational drugs?
No, doctor, never.
Nothing. Okay.
Yes.
I will examine the legs for any weakness.
No, no weakness.
Nothing. I will offer for neurological examination, tone
Normal.
and power and reflexes.
Normal, doctor.
All are normal.
Yes.
Okay. No scars for any bone, any surgery before. He denied, right? But I have to offer any scar over his body.
Normal? No, doctor, I have no trauma.
Okay. Yeah. And any trauma to your back recently?
No, I didn't notice, doctor. No,
And did you lift any heavy object recently?
I didn't notice, doctor. No, my usual daily activity. I don't notice.
Okay. When you move, do you feel this pain more?
Yes, doctor. Yes.
And
Dysentery pain is severe.
when you move also, you notice that any weakness or pains going to the legs when you have this?
I can't move, doctor. I can't walk.
You can't move at all. I can offer oxybate wall test,
Oxybate, okay, normal.
normal. Any rash over his hairline in the
Normal.
scalp?
Normal, no.
Nothing. And you told me no stones in your waterwork.
No, doctor.
What about the timer?
2 minutes and a half.
Okay. In any intimacy relationship problem?
No, doctor, never.
Did you take any herbal remedies or
No, doctor, never.
did you try anything? Okay.
No. My intimate relationship is good, no problem.
Okay. And you told me no family history of same condition.
No, doctor.
Okay. Any bleeding anywhere from your body?
No, doctor, I didn't notice.
Okay. Now I will ask what are your concerns?
Yes, doctor, what I have, is it cancer?
I appreciate your concern, Mr. Sami. I can reassure you it's almost or unlikely to be a cancer. But we suspect some conditions. We have to run some investigation to confirm it. You have any other concern?
No, doctor, thank you.
Okay, so Mr. Sami, for the meanwhile, I can give you a painkiller and I will admit you for this severe back pain.
Okay.
Can I ask you about your diet?
Yes.
Do you take vitamins or supplements in a well
Yes,
amount?
yes, doctor. Yes, doctor. I have a good diet regime with my dietitian.
So it's balanced diet.
Yeah, sure, doctor. It is balanced diet. Yes.
Okay. Any other concern, Mr. Sami?
No, doctor. Thank you.
Okay. Please, in the meanwhile, also don't carry any things, especially the heavy things, until we confirm your diagnosis.
Yes, doctor. I can't move. I can't carry anything.
You can't move.
Thank you. Yes, doctor. I can't carry anything, doctor.
Okay. And you told me nothing, no redness, no swelling.
No, doctor. No.
Okay. Okay, Mr. Sami, thank you for letting me examine you today.
Thanks, doctor.
How's the time?
10 seconds.
10 seconds. Okay. Any bone disease in the family?
No, doctor. Never, doctor.
Okay. Okay. Time is up. Let's start.
Okay, Dr. Basim, what is your, tell me your positive finding?
Yes, Mr. Sami, a middle-aged male, came with a complaint of back pain. The positive finding in the examination only localized tenderness with no redness, with no swelling, with no deformity, obvious deformity. I examined the
Any
exhibit
other?
wall.
Yes,
Yeah,
all negative, doctor.
all
What
were
is,
negative.
yes,
Yeah.
what is the finding of this patient?
The
As a
finding,
finding, you find anything other than the tender or pain in the lower back?
no, I couldn't find any. He doesn't have any symptomatic.
What is the previous past history of this patient?
The history, he denied anything related, no
No,
trauma.
he tell you, doctor, that he has, I think, a loose motion.
Okay, he has, yes, loose motion the last week, yes, last month, yes. So
Yes.
yes, I can say this is related, might be related. Enteropathy, arthropathy, and arthritis, enteropathy, arthritis, yes.
Okay,
Reactive.
doctor, what is the type of this loose motion?
Oh, yeah,
Yes, doctor.
yes,
Yes, Dr. Basim, it is the only finding in this patient.
yes,
This,
yes.
this patient tell you he has inflammatory bowel syndrome and he take
Irritable.
irritable bowel syndrome. Yes, irritable bowel syndrome. This patient, when you asked him, it is the first time. What about your? Is it flushable? Is it the first time? How many times in the past? He will tell you, yes, doctor, I have mini loose motion, so I adopted lifestyle and also I adopted regime This patient diarrhea was greasy and also difficult to flush. So the patient was misdiagnosed as celiac. Patient has celiac disease, and also he has osteoporosis. And now he
Okay, it's ask me for the differential and explore with me the case, not
yes,
correct
doctor.
me. Don't
Okay.
correct, just examine. Give me examiner question.
Okay, the examiner question. Okay, what is your diagnosis? Forget celiac, okay? Okay. What is your
Uh,
diagnosis?
okay, well, my case might be reactive arthritis or enteropathy arthritis. This is my
Okay.
differential.
Okay,
And
this patient,
it's a mechanical pain, back pain. It might
yes,
be
you told,
related.
yes, doctor. Yes,
Uh-huh.
are you asked if the patient has any prostate changes? Patient 48 years old.
No, he
Maybe,
deny any change in his water work.
no, you asked him about the frequency and increase water, increase the frequency and the amount. Patient may have dribbling water in the night. At the night he go to the bathroom. He might have that. This patient doesn't have these symptoms, but this is the question of the examiner. Okay,
Okay.
this mechanical back pain. Okay, are you excluded brucellosis of these patients?
And no, I didn't ask about any exposure to any animal or because his job is far away from these things.
Yes, his teacher might be his in the village.
Okay.
Okay, about the trauma. You asked lately about if the patient
Yeah.
has trauma. Okay. Uh, okay, how is this patient? This patient has increased alkaline phosphatase and normal serum calcium, normal corrected calcium. So
Yeah,
what?
osteoporosis. On the top of them, osteoporosis.
Okay, osteoporosis will be alkaline phosphatase normal. So what do you think?
Yeah.
Why alkaline phosphatase is high?
Why alkaline phosphatase is high? Because of fracture.
Yes, because of fracture. Okay, if this patient have osteomalacia, why didn't you tell that this patient has osteomalacia? This is the corrected calcium, not the calcium. So why don't you tell that the patient has osteomalacia? Why osteoporosis?
Because no proximal myopathy.
And no, osteomalacia also has.
Hypocalcemia.
Okay, patient corrected calcium is normal, not the calcium is normal. So the
Mhm.
patient may have also osteomalacia. What is against that?
Again, this patient is not osteomalacia.
Yes. Why we tell that the patient has osteoporosis? Why not osteomalacia? Osteomalacia also calcium will decrease. It is in this uh, the corrected calcium which is normal, not the calcium.
Okay, I know. I
So
can't.
what do you think? Okay, Dr. Bassem. Okay, this the only finding in this patient. Okay, time finished, Dr. Bassem.
Okay.
But you did great. But the only finding this patient is lose motion. We have to search about this motion. When the first time, how many attacks you have this lose motion? What is consistency, flushable, difficult to flush? Maybe he wrong diagnosis. Patient, Dr. Bassem, inflammatory syndrome always misdiagnosis even in communication with celiac disease. So patient has celiac disease, and in this case, the corrected calcium is low. So the calcium is low because albumin is low. So the patient has celiac disease and has decreased vitamin D and decreased calcium. Patient has osteoporosis, alkaline phosphatase increased due to fracture, um, and also patient the examiner when the examiner tells the doctor why not osteomalacia, because in osteomalacia, yes, alkaline phosphatase is high, but there is his body tender, all his bone is tender. You asked me about is there any pain in your body? I told you no. So the patient doesn't have any osteomalacia. Patient has osteoporosis. So the examiner comment on the doctor about the doctor didn't ask about trauma, so he comment on the trauma. He didn't ask the patient if he has any trauma or not. The patient doesn't have any trauma, but we have to comment on trauma and also on steroid. You should ask the patient if you have take any steroid. Patient was may take steroid for any disease, like maybe have common cold or anything, take steroid for anything. So he may have had the steroid. So we have to ask about steroid. Patient didn't take steroid, but the examiner tell him that he should ask about steroid. Also, he should ask about TB and brucella. So what do you think, Dr. Bassem?
I think you can judge me now, or whatever the judgments.
Dr. Bassem, satisfactory. I am the
No.
examiner. I am the examiner. I have the right to do
Again.
anything. You know?
Again.
You
Okay,
know,
I will ask Dr. Azhar. Dr. Azhar for judgment. No, please, Dr. Mahmoud, be honest and judge me
yes,
according to the performance.
but you know, Dr. Bassem, it is a famous
No,
mistake. This patient has loose motion, and he told you I have the doctor told me that is inflammatory bowel syndrome, and I have loose motion. And I told
and now
you
it's controlled,
yes,
right?
yes, patient has.
How the inflammatory bowel disease will be controlled
No,
with
doctor,
just diet?
it is not inflammatory. It is celiac disease.
Okay, even celiac. You mean by diet? You mean, right?
Yes, you don't run for the loose motion.
Okay.
If you told me the loose motion, I will tell you it is greasy and
Related to the food.
related.
Yes.
No, I will tell you it is not related to food.
MashaAllah.
Yes, in the exam he told
Why it's not
he told
related to the food? Why it's
no
not
no
related
no
to the food?
No,
doctor,
he will hide, doctor. He
yes,
mean this.
I
It
will
was
tell
by
them
بس
instructed.
اللي حيساعد الميكانيكال versus inflammatory. لو كانت inflammatory كنت حتقول حتى لو قال لك جريزي حتقول كرونز، لأنه كرونز ما الابزوربتيف بس مع inflammatory back pain. لكن
but this is
مجرد
mechanical. Yes.
ميكانيكال فهذا حياخدك أكتر للسيلياك. فأنت الحلو إنه you picked up the type of the back pain، فهلأ صار أسهل عليك إنك تمشي الدايرية على حسب الباك بين. لو كان باك بين انفلاماتوري حتروح اي بي دي اكثر، لانه عادي كمان الاي بي اس كان بي مس الاي بي دي كان بي مس دايجنوز از اي بي اس، بس التايب اوف ذا باك بين هو اللي حيفرق. لو كان انفلاماتوري حتحط توب اوف ديفرنشال اي بي دي، لو كان ميكانيكال حتحط توب اوف يور ديفرنشال اوستيوبروسيس لانه والسيلياك. تمام، فهون اللي حيلعب دور معك، هون اللي حيفرق وحيسهل لك الموضوع. حتى لو ما عطاك typical features of diarrhea، خلص
Yes,
diarrhea
and
crazy أو حتى difficult to flush whatsoever، قال لك هي diarrhea مع شو نوع الباك بين، امشي مع الباك بين، لا تمشي مع الدايريا. الدايريا بس حتقول لك إنه في جي آي related etiology لهالباك بين، بس بغض النظر عن طبيعة الدايريا. حتى لو كانت ووتري، لو قلت لك أنا هلا هي ووتري دايريا
yes,
وفي عندك
yes.
inflammatory back pain، شو هتختار؟
Crohn's.
عليك نور، حتختار كرونز ورياكتيف مثل ما انت قلت. ولو قلت لك ووتري دايريا مع ميكانيكال حتختار سيلياك. فحتى لو شو ما كانت الدايريا، فبالنهايه الباك بين اللي بيمشيك.
Yes, I got it now. Yes, thank you, Dr.
Yes, in this case, Dr. Bassem, the surrogate tell the doctor that I didn't notice any change with the food. Really, he tell him that.
I know.
I didn't
They
notice.
hide. They instructed by the examiner.
Yes, so this celiac disease, you should have run to this loose motion when it started. It is what is the consistency? So it is the only mistake.
Yes.
والاي
Okay.
بي
So
اس will never cause anemia. يعني عادة هدول البيشنتس بيقول لك أنا عندي fatigue I'm following for anemia. عن جد الاي بي اس لا بيعمل weight changes ولا بيعمل anemia، ولا البيشنت حيجي presented by any symptoms. يعني لو اي بي اس مع back pain وهو young 48، فبدك دائما وقت بتلاقي في back pain بتلاقي
in
في
English, Dr.
anemia،
Ahmed, please. Yeah.
بتفكر بشيء، يعني بتفكر you will question the IPS really you will question whenever
Yes.
there is an extra symptom.
Yes. Okay. Good case, Dr. Mahmoud. Yeah, Dr. Azhar.
The patient is not giving any relation with the food, but He must be giving the history of greasy, difficult to flush away, foul smelling.
Yeah. He will say that, but
Yes,
if
I
you
will
ask
say.
him, yeah,
If
he
Dr.
will
Bassem
say.
ask me, I will say that. Yes, it is the only finding in the patient. The only finding.
Yes, I agree. Yes, I agree.
This case with the same investigation, alkaline phosphatase increased, came in Egypt last night. And also in India and Pakistan, the same patient, mechanical back pain with celiac disease. It is the same case.
So we
Uh,
can put the differential diagnosis, celiac at the top, then osteoporosis, then
yes,
osteomalacia.
yes.
Because in osteomalacia, it is usually because of three reasons. Either we are taking a decrease in take of vitamin D, or there is a malabsorption like celiac disease, or there may be chronic kidney disease, chronic kidney failure. So there are three conditions causes for the osteomalacia. In osteoporosis, alkaline phosphatase is raised because of fracture,
Fracture, yes.
in osteomalacia, alkaline phosphatase is raised due to compensatory osteoblastic activity, and the
Yes,
calcium will be low. Calcium will be low, and the parathyroid hormone will be raised in osteomalacia. But in case of osteoporosis,
normal.
calcium,
On investigation,
phosphate,
normal.
and parathyroid hormone will be normal.
Yes, he put
All three,
alkaline
right?
phosphate. Yes, Dr. Bassem, go on. Sorry.
Yes, three will be normal. Calcium, phosphate, and parathyroid hormone will be normal. Only alkaline phosphatase will be raised. Dr. Basam tried to rule out Paget disease. Also, he was asking about the head size, any problem with the hearing. But
Yes.
Paget disease usually affecting the long bones. Paget disease, and
Hmm.
it is usually with 60 to 70 years. Usually.
Yes, you're right. Yes. Okay, thank you, Dr. Azhar. Any comments? Any question? Who will put the judgment, Dr. Hind?
Sorry,
Dr. Hind.
sorry, Dr. Bassem. Sorry, Dr. Hent. I am the examiner. I will put it. I'm sorry, Dr.
Yeah.
Bassem.
Have we finished the grading? Just because I have few
Yeah.
comments.
Go ahead, because Dr. Mahmoud will give me again satisfactory. I don't know
Fine.
why, even if I didn't reach the diagnosis. Okay,
So
good.
if we get just this home message from the back
Yeah.
pain. So first thing, the mechanical or inflammatory is the most important thing.
Yes.
Compression symptoms.
Mm-hmm.
And rule out
Exactly.
loin pain because it could be pyelonephritis and this back pain. Mechanical back pain, I think trauma, osteoporosis. Osteoporosis means Cushing or steroids or celiac disease. I will put all together osteoporosis, osteomalacia.
Yes.
Multiple myeloma, discitis, TB, staph. Weight gain alone can cause mechanical back pain, brucellosis,
Osteoarthritis.
metastatic disease. So prostatic cancer is
Yes.
the most common in male. Um, inflammatory ankylosing spondylitis, seronegative, or enteropathic or inflammatory bowel disease. I think good point from Dr. Hind. She said back pain depends on the inflammatory or mechanical. You will judge the diarrhea. So again, osteomalacia, proximal myopathy, and the
Mm-hmm.
alkaline phosphatase is always raised. Osteoporosis, I think calcium can be low in osteoporosis as well.
No,
Normal.
normal.
Everything is normal.
Everything is normal.
Osteoporosis, everything is normal. Unless the fracture happen, alkaline phosphatase will be high.
So even the parathormone.
No, all
Parathyroid
normal.
normal.
In
Normal.
osteoporosis, Ahmed, normal, all
Normal.
normal.
Normal profile, bone
No,
profile.
profile,
So
yes.
what is the reason of osteoporosis?
Vitamin D deficiency.
No,
No,
vitamin D deficiency, osteomalacia.
No. It's not vitamin D deficiency. It's
Decrease.
abnormal bone formation.
Steroids in bases. Steroids can cause osteoporosis and Cushing. Anything
Saline
else?
filter, saline filter also can cause
Sorry?
Yeah,
osteoporosis.
decrease
else?
the
Saline,
testosterone. Yes, Klinefelter.
Yes, yeah. So some
Estrogen,
Klein and the Coleman, both of them,
and also menopause.
Klinefelter and the Coleman syndrome.
Menopause any this estrogen deficiency, and there is
Turner
risk.
also. Turner also.
Yeah, there is risk factor, Dr. Mahanna. You can say smoking, thin people,
Mhm.
alcohol. All these can be high risk for osteoporosis.
And old age.
Yeah, because of decreased oral calcium intake or calcium intake. Yes.
If you want to remember the risk factor to osteoporosis, you will see O mean we can make it low calcium intake. Low, it will come in, this O will come in the low. The S, it will come as seizure, seizure medicines like anticonvulsant medicines, they can cause. Then T will come, T, thin build, it can cause osteoporosis. Then E will come, ethanol intake. Then O, hypogonadism. Then P, previous fracture. Then O again, thyroid O is coming in the thyroid, just to remember. R, race is white and Asian. And O, other relatives with osteoporosis. S, steroids. I, inactivity. And finally S, smoking. This is a big mnemonic.
Yeah, please, if you can type it to the WhatsApp group.
Yes, Dr. Azar, please.
Kindly, Dr.
So
Azhar, yes.
so celiac disease cannot cause osteoporosis, can cause osteomalacia.
No, can cause both.
Double,
Calcium
yes.
deficiency.
Osteomalacia and osteoporosis.
Yeah, so osteoporosis can come from steroids or can come from celiac as well.
Yeah, malabsorption.
Okay, any malabsorption. So chronic pancreatitis can cause.
Any of them. Irritable bowels, inflammatory bowel syndrome cannot cause malabsorption unless there is complication like short bowel syndrome after resection. But it will be inflammatory association. That's why it's
I mean,
not.
if back pain came in long case scenario, I
Yeah,
think it should be related to multi-system disease like celiac, inflammatory bowel. It will not come because of old age or just alcohol.
yeah. It will be related to other system, either due to diarrhea, especially in the young age,
Mm.
or inflammatory, and search for the inflammatory condition. What is it? Ankylosing or rheumatoid or psoriatic. This is the inflammatory cause.
Okay, and what is the cause of malabsorption? If we summarize celiac disease, inflammatory
Celiac
bowel,
disease,
chronic
inflammatory,
pancreatitis.
Short
Mm.
bowel.
short bowel syndrome, and inflammatory bowel. But inflammatory bowel itself is not causing malabsorption unless there is complication, like
Yes,
short
yes.
bowel syndrome.
The Edison also causes malabsorption.
Addison, the malabsorption diarrhea?
No,
Yes,
I
yes.
don't think,
No,
Dr.
no, it's not. Yeah,
I don't think,
it's
Dr. Azar.
diarrhea, but it's not malabsorption diarrhea.
But in Edison, there will also greasy, foul-smelling, difficult to flush away. History will be like this.
Um, it's watery diarrhea, Dr. Azhar, what I remember.
I from 2-3 mentors I have discussed this thing. They all said no.
Really?
Yes, it is malabsorptive diarrhea because I was also confused about Edison.
Uh-huh.
It's not
So
common.
it,
It's not common. So we need to put 3 differential diagnoses. So we'll put the celiac and chronic pancreatitis, cystic fibrosis.
Yes,
Uh-huh.
yes.
yeah, the common is common, yes.
Yeah.
Okay. Cystic fibrosis is also malabsorptive.
Yes,
Yeah.
exactly. Chronic pancreatitis, celiac,
Because I
and
was also confused about the Edison's, but they told no, it is malabsorptive Edison.
Yeah.
okay.
We can confirm from some other mentor. Huh?
Okay. Okay.
Mohammed,
Anything?
can you repeat the calcium and albumin, the corrected and non-corrected things that you explained?
Ionized calcium and total
Yes,
calcium.
yes. Can you explain this one?
Yes, doctor. The corrected calcium is by formula. It is not measured like calcium or phosphorus. This case came to trick all doctors about increased alkaline phosphatase and the normal corrected calcium. In celiac disease will be decreased albumin. Albumin will be decreased. So he didn't put in that the calcium is decreased. No, he put corrected calcium is normal. That means the calcium is normal. That means the calcium, the normal calcium is normal. If we replace the patient with albumin, so the calcium will be normal. So this patient is increased alkaline phosphatase and normal calcium. But
No, suppose the opposite, Dr. Mahmoud. If the albumin is low, the total calcium will
the
be
total calcium will be low, yes. But
total calcium will be low. Yes.
yes, but he not but in this case the total calcium is low because he wanted to diagnosis is osteoporosis.
He wants.
Yes,
They
he
want to
want.
distract you. Okay.
Yes, yes. If he bought increase alkaline phosphatase and decrease osteomalacia, okay, it is osteomalacia. It is a case of osteomalacia, no problem. But he need to instruct you increase alkaline phosphatase and normal calcium, so you'll put in your mind that it is Paget disease. He will يعني he will هيوديك في مكان تاني خالص غير
Yeah, he mislead you.
Yes, he will mislead you. He want to mislead you. He want to, from you to
Yes.
to know how to yes يعني ازاي بتفكر يعني. So if yes, so he need from you the only approach. The patient has loose motion, so search for this loose motion. If you go with loose motion, the character anything, so you will catch this celiac.
Okay.
Thank you.
And you have to mention albumin in your investigation, Dr. Sarah. Whenever you mention the investigation, you can say calcium ionized and total, and you can also say liver function test, searching for or looking for albumin to calculate the corrected albumin, corrected calcium.
Okay.
Okay.
Okay, thank you.
And bone profile, including parathyroid, because we didn't mention the investigation, parathyroid, vitamin D, phosphate, and calcium. All parathyroid profile or bone
Yes,
profile.
but in the exam, Dr. Basim, he mentioned that only alkaline phosphatase and normal calcium. That only in the exam. He mentioned both only. Don't mention anything.
Yes, I can say bone profile and I can tell him what's expected to be
Yes.
low. In this
Yes.
patient, the
Will be-
calcium,
The examiner will tell you about what's the investigation, what will you see in osteomalacia, what will you see in osteoporosis. So he will tell you why alkaline phosphatase is high. So you will tell him that we suspect a fracture, and also he will ask you. He will comment on. Didn't ask about steroid. He comment on that. Why don't mention steroid? Patient may have take steroid in the past, and also he mentioned about trauma, and also. ذات اسمها ايه بروسيليا
brucellosis.
بروسيلوزيس. Yes, he comment on brucellosis. Yes.
Okay.
Just that.
Dr. Basu,
Yes,
as you
Dr.
mentioned, that in celiac disease, this back pain will be mechanical back pain?
Osteoporosis only. If
In
osteoporotic, yes,
celiac disease.
yeah, because of hypocalcemia, it will lead to osteoporosis and osteoporotic fracture. By the way, osteoporosis itself cannot cause back pain, but when it fracture, when the osteoporotic bone will fracture, now the pain will come.
So then why the pain in celiac disease?
Yes, pain due to osteomalacia. He may come also with osteomalacia, Dr. Azhar. Osteomalacia is a pain, but osteoporosis no pain. If the patient fracture, so that's why he put in the case alkaline phosphatase increase.
And why there was back pain? Yes, it's a good question, Dr. Azhar.
Yes, fracture.
No, the fracture will be acute and it will be severe. Like in this scenario, the 3 days. For you said to
Yes,
me
increased. Yes, it's been started since 1 month. So it is just fissure and increase, let fracture, become fracture.
Okay.
That is the case, Dr. Basim. يعني the same case.
Yes. It's better to know this in the practice rather than in the exam. I agree 100%. Even we didn't reach now or today, but yes, it will be memorized forever. Whenever you have it in the exam, you can catch the case because not all, most of the case now are tricky. Like this scenario, tricky. There is condition and pathology associated with the complaint or the complication. So we have to learn how to correlate and to reach the diagnosis well. Even with good approach, yeah, you have to do the good approach and to correlate why this patient is having this along with that. For me, I should and I didn't do that. Analyze more the diarrhea, even it's controlled. This is my fault. I didn't ask after it was controlled why it's controlled.
Yes, you asked me when was last time, not asked me
Yes.
when was the first time. I will tell you it was since 20 years. I have always diarrhea, and
Yeah, but
it was
you told me
increased.
irritable bowel, and when you change
Yes,
the lifestyle, it's controlled. That's
it
why,
is. Yes,
yeah,
it is misdiagnosis.
misdiagnosed. And I didn't also analyze it well because it's already well controlled now.
Mhm. Yes.
Yeah, but still, I can say it might be related to the GI infection post-reactive. I mean, this the most related, or it was for me. It might be explaining the symptom, but it was wrong, by the way. But if you ask me what the case, I will say like that. Reactive arthritis after back pain, after GI or gastroenteritis. But it was wrong. Anyway, we are learning from the mistake. Any comment from others? Any question? Osteoporosis or Malaysia? No, it's not Malaysia. Yeah. Sorry, Dr. Azhar.
No, so no. I was also looking the chat box.
Yeah, someone asked, is it Malaysia or osteoporosis? No, it's not Malaysia. Malaysia will be associated with proximal myopathy, and will be in the thigh and in the same. It will be also associated with proximal myopathy. So I also should do proximal myopathy. Can I ask you? Can you stand from sitting position without using support? It will be difficultly a little bit, and the back pain. It will not be localized to the back. It will be more down and more in
Yes.
the thigh. And you might have the patient with bone bowing the legs, bowing of the legs. This is the osteomalacia. But here it's localized to the vertebrae, so it's osteoporotic one. It's not osteomalacia, okay? But you can have osteomalacia with celiac. By the way, celiac can be presented with any deficiency of any enzyme of any vitamin. So you can suspect as this patient hypocalcemia. It might be present with osteoporosis. Vitamin D deficiency. It will be osteomalacia. Vitamin A deficiency. Vitamin D, the fat soluble. I mean, vitamin A, D, E, K. Okay, vitamin A, D, and E and K, which is ADIK, A, D, E, K. And according to the vitamin deficiency, you will know what the case. Also, they can correlate with another deficiency. Calcium, we mentioned the calcium. We mentioned the vitamin D. What else can be deficient in malabsorption syndrome? Anyone can remember?
Vitamin B.
Vitamin B. It will
Mm.
be, I think.
Iron, Dr. Basim. Yes, no, iron,
Yeah,
iron.
iron. Yes,
Iron,
iron.
yes. Vitamin B in
Yeah, that's
blood.
why the patient will have anemia. Yes,
Yes.
anemia. Yeah, anemia.
Anemia,
Vitamin. Yeah,
osteoporosis, osteomalacia.
megaloblastic anemia. Megaloblastic anemia. Yes, patient might present with megaloblastic anemia as vitamin B. Yes. What
So
else? Yes, yeah,
so
Dr.
Dr.
Az.
Mahmood. So Dr. Mahmood,
Yes,
what
doctor.
will be the what if the examiner asks, what is your diagnosis? Can we say my patient is having osteoporosis complicated by the celiac disease? Can we say like this?
Yes, yes, that's that's the diagnosis. The patient was misdiagnosed as inflammatory syndrome. So I have now loose motion with greasy inconsistency, difficult to flush. So the patient has celiac disease and has osteoporosis and increased alkaline phosphatase due to fracture, recent fracture. That's the diagnosis.
So simply we can say patient is having osteoporosis complicated
Yes,
by celiac disease.
yes, but yes, complicated by fracture. Yes, that's why alkaline phosphatase increased.
And try, if you mention mechanical back pain, it's
Sure, Dr. Basim, yes,
yeah,
it's a mechanical
it's
back pain. Yes.
back pain. Yeah, it's good to get a good mark in the approach or the clinical communication, even in the differential. You can give him, while you didn't reach the diagnosis, but you can give him the osteoporosis still as a differential of mechanical back pain, and you might get the mark by this, but it's not a must. I mean, he might also deduct your mark if you didn't tell him this is osteoporotic fracture because of celiac, because you have to know what is the relation between this and that.
Lose motion and mechanical back pain. Yes.
What are the differential? Okay, good question, Dr. Tabasso. The differential osteoporosis or osteoporotic fracture, osteomalacia, and you can say other back pain, discitis, but it's not the case here. Trauma or disc prolapse. This is also mechanical pain. Trauma to the back or disc prolapse.
And multiple myeloma, can we also say?
But no
Yeah,
lose
you
motion,
can say
no change in urine.
bone
Yes.
metastasis, but against that, there is no metastasis
Yes.
or no multiple myeloma signs and symptoms. But it's
The
one of the
examiner,
differential.
yes, the examiner asks the doctor why the patient doesn't have multiple myeloma, patient old age. You asked about multiple myeloma? Yes, he asked about lose weight, loss of appetite, and no urine changes. So not have any multiple myeloma.
No, the case will be different, totally.
Yes.
Multiple myeloma patient will be different in the manifestation, in the symptom, in the complaint. Crab, you will find crab,
No crab. Yes.
hypocalcemia, and renal
Hyper
failure, and
and
anemia,
hard
and bone pain.
and hard
Yeah.
bone pain and hard motion.
Yeah, because of hypercalcemia, yes, hypercalcemia.
Yes.
And the other
Hyper.
hypercalcemia signs and symptoms, not only hard motion. You will have a lot of finding.
Yes.
And the patient will present different way. This is the conclusion. It's different manifestation. Either he will present by anemia, or he might present with bone pain, or he might present with renal failure. And the renal failure, you can enumerate a lot of finding or a lot of complaint, like dizziness, like confusion, like tremors, decrease urine output. So the acute kidney injury or acute renal failure or oliguria or kidney failure patient might present with any of these symptoms. Okay, so it will be a different case. So what the cause? Osteoporosis here. Celiac cause malacia. No, celiac cause osteoporosis. Osteomalacia, one of the differential, but it's not the case. This is not osteomalacia case. It's osteoporotic case.
The same
And by
case,
the way,
Dr. Basim, the same case came
go ahead.
in Pakistan and India, but only that back pain, not mentioned alkaline phosphatase or calcium. So
Okay.
it will be easy. You have loose motion, yes, so he can be diagnosed. But here in Egypt, he put alkaline phosphatase to mislead you
Yes.
to
Okay.
another direction. Yes.
Yeah. What about budget? So the whole investigation budget normal,
Normal increase alkaline
apart
phosphatase.
from okay, yes, increase alkaline phosphatase. And the diagnostic test for budget is
Hearing, I think hearing.
The hearing
no,
aids.
this in the history. No, this in the history. I mean test investigation. You know the
No,
test
doctor, no.
in the urine, hydroxyproline in the urine,
No, I am not advanced.
Yes. I forgot.
urinary hydroxyproline.
Yeah. Yes. I think something like this. I
Yeah,
forgot, but I have read it.
yeah,
I, you,
yeah. It's
urinary
urinary hydroxyproline. Okay, I think
but
we are done with
but
with two cases. Yes.
but in case
Yeah,
of
Dr.
Paget
Azhar.
disease,
Yes.
if we will see any hearing device, it will also be a clue
Yes,
for us.
sure. Yes. And you have to ask about, you can ask also a question for head size or head size.
Yeah.
Yeah,
Yes.
it will be clue by
As you
hearing
asked,
aid or,
as you asked in this
yes.
scenario, you asked. But
Yeah,
today
and also
these two
it's
scenarios they
mechanical.
were very good. Today these two
Yeah.
scenarios they were very good. We learned a lot.
Thank you, Doctor.
Thank you, Dr. Azhar.
Thank you, Dr. Azhar. Dr. Hatim, vitamin D deficiency, which may cause by celiac, means osteomalacia, not porosis. No, we didn't mention vitamin D here will be deficient. We are doing investigation and the difference between osteomalacia and osteoporosis, vitamin D level. In osteomalacia, vitamin D level will be low. In osteoporosis, no deficiency in vitamin D. Okay, clear? Osteoporosis is normal bone profile all over from calcium, phosphate, vitamin D, and the last alkaline phosphate. Everything is normal. It's not. It seems like nothing in the bone profile. Symptomatic only. Or you can do the DEXA scan. You can do CT scan. You can find it occasionally. DEXA scan is the most diagnostic. DEXA from minus 2.5 to minus below minus 2.5. This called osteopenia. Osteoporosis will be below minus 2.5. This is
Just
DEXA
like
scan.
Dr. Basam, I did my DEXA scan as a routine, and it came to be minus 2.5, minus 2.5.
Yeah, it's borderline, or it's called
But
osteopenia, not osteoporosis.
yeah, osteopenia, and I don't have my calcium normal, phosphate normal, alkaline phosphate is normal, and I don't have
Yeah,
any
everything
symptom.
is normal.
I don't have any
Yeah,
symptom.
yes. This is the problem of osteoporosis. It might be asymptomatic until you have fracture
Fracture.
because of weak bone. Yeah, because it's reformulation of the bone or calcium in the bone, but everything in the blood normal. This is the mechanism of osteoporosis. And the risk factor, you have to avoid it, to ask about it, the alcohol, the smoking, the weight, the testosterone deficiency or in male and estrogen deficiency in female. These are the difference and the risk factor for osteoporosis. Osteomalacia is totally different. You have low calcium, low vitamin D. I guess phosphate it will be high
Low.
or normal, sorry.
No, will
Low
also be low.
also?
Yes,
Low. So
phosphate will also.
all bone profile, yeah, phosphate, vitamin D, and calcium will be low. And by the way, there was history taking case before in the old format. It was about osteomalacia, and the clue was exposure to the sun only. Patient was not exposing well to the sun. That's why the activation of vitamin D was low, and that's why also they brought a female patient, especially the Muslim female. They have high risk to the osteomalacia rather than the others because of the sun exposure. They put it as a scenario like this, tricky scenario, but I think it's not common nowadays. Anyway, we have to know the clue as in this scenario. Okay, I think discussion was great today. Thank you, Dr. Mahmoud, of course, for the case.
Thank you, Dr. Bassem. Thank you very much.
Yes, and
Good
I hope.
cases. Good cases today. Well done.
Thank you, Dr. Ahmed. Thank you, everyone, for listening and attending every day. Dr. Azhar, Dr. Hind, Dr. Sarah. Any comment from others, please? Any question? Any unclear point need to be clarified? The most important question at the beginning, you have to know what is the pain. Is it mechanical or inflammatory? And the clue will be the movement or the wrist. So the mechanical pain will worse with the movement, and the inflammatory pain will improve with the movement. This thing will put you on the track to either differentiate between mechanical and the inflammatory. And you have to know about the whole cause of inflammatory to ask about them. And you have to ask about all cause of mechanical if you have the mechanical. This is the take home message. Okay. At least if you reach to the mechanical, you can enumerate the causes and you can get the mark by enumerating these causes. Maybe it will be the case. Thank you for listening to us today. And thank you to Mahmoud for practicing with me. We can end the session. We'll see you tomorrow, inshallah, with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa
Thank you.
barakatuh.
Dr. Bassem.
Thank you.
Thank you.